when we mention autism, it's a condition related to the development of the brain. And as a result of that, everything we see in autism is from that affectation of the brain. Femi Flavor, I see you. Please share back to Unique. Unique is not here. She left. She said she'll be back, and she's not here yet. So, autism affects how this individual relates to the world, the environment, to their family members, to their loved ones. Good evening, Femi Flavor. I see you, sir. And it's good that we understand it and we discuss it. Let me turn off these headphones. I don't think I need these headphones for now. It's good that we discuss it and understand it. And an important part of it is understanding how it evolved. So I'm Dr. Temitope Ogunshola. I'm a medical doctor, and I come on TikTok once in a while to bridge the information gap. Mr. Henry, I see you. So please tap your screens, tap your screens, tap your screens. Autism is a spectrum. It contains so many other diseases, so many other symptoms, so many other things going on. From very mild and subtle symptoms to very severe symptoms. But the base problem is a problem with the development of the brain and the affectation of this person's ability to relate with the environment. So, while there's no cure for autism, because I have to say that from the outset, while there's no cure for autism, detecting it early can help this individual adapt better to the environment and cope through the disease better. What are the symptoms? What are the symptoms? What would we see in this person and say, look, this thing this person manifesting is likely to be autism? Because it can start from early infancy, as low as 2 years. There will be reduced eye contact. People that are autistic do not really want to look at your face. Do not really want to meet eye to eye. Do not really want to give eye contact. So they are either looking down, focusing on what they are doing, looking away, because the part of the brain that engages in non-verbal communication, that is a smile, a frown, facial expressions, they have problems with it. So these individuals, they don't understand when you smile, they don't understand when you frown. They themselves don't express facial features, facial expressions. So from early infancy, you have things like lack of response to their name. So you call this child, and sometimes the child doesn't even hear you. You call this child, the child knows the name, but doesn't hear, doesn't respond. You call, they don't respond. They're kind of indifferent. They're not bothered about what's happening around them. They're focused on one thing they're doing, and that one thing alone. The problem for some children is that they may seem to be developing normally. Kia May Love, I see you. These people may seem to be developing normally for a while before this disease now kicks in. So every child with autism has its own features. Every child with autism cannot be lumped up as a group of people. You have to deal with each child individually. So lack of facial features or facial expression, lack of eye-to-eye contact, being withdrawn to themselves, not communicating with others, not able to start or sustain conversations. There may be delay in cognition, that is, Dr. Sparky, I see you. that is learning, there will be learning disabilities. You're welcome everyone. You're welcome. Yes, that's what I said, Mr. Femi. It's not a malfunction per se. The malfunction is as a result of the development of the brain. So when the development of the brain is impaired, then Mr. Adibole, I see you. Reverend, I see you, sir. So when the development of the brain is impaired, of course the ability of the brain to function will be affected. And it will run across so many things. But usually the social part, the emotional part of the brain that is affected. The part that interacts allows the child to interact. I see you, sir. You're welcome. With the environment. The way we interact in the environment is we see things, we respond. We see people, we respond. These people have that impediment. So, some children may have learning disabilities, while some other children may have quick learning aptitude. You can see that it's not a typical, headache, malaria, this. Each child has their uniqueness. So the moment you understand this child, you'll be able to attend to individual child and help them go through life better than if you didn't know about it at all. So, number one, there's a problem with social communication and interaction. Doesn't respond to his name, poor eye contact. These children do not want you to cuddle them. So you want to cuddle, you want to hold, my baby or my friend or my child. This child is averse to it. They will throw tantrums. Remember, it's not a general rule. These children do not want you to be too close to them. They don't even want you to touch them. This children does not speak or has delayed speech. Please tap and share. Please tap and share. We're only 3 people here. I wish we could have more people. Tap and share. Let us have more people. Big Mama, I see you. So people that have autism will have delayed speech. They don't want you to hug them. They don't want you to hold them. They don't even look at your eye. They always look either looking down or looking away or focusing on one particular thing. You call them, they pretend not, or they do not hear or do not respond. They may not even be able to pronounce certain words, even at the age they're supposed to speak. Thank you, Big Mama. These people with autism, they cannot even initiate a conversation. Hello, how are you? No, they won't be able to do that. Remember, it's a problem at the level of the brain's development. Randa, I see you. Welcome. Please tap the screen. Let's have more people. Thank you. I didn't want to set a goal. Let me set a very low goal. Let me see 1,000 roses. That's out of the way. Okay. So, thank you very much. Mosquito, don't worry. I will not be here tomorrow. So, these people speak, the ones that speak, that are autistic that speak, you notice that the tone of their voice is kind of robotic. The kind of tone, they're not speaking with the way I'm speaking. They may have just one tone. Hello, how are you? How do you do? I'm going out. I want biscuits. I want this. I want. So they're not talking like the normal. I want biscuits. Oh, hello. How are you? Hello. How are you? Come here. Go there. So that tone that distinguishes individual, that distinguishes emotions is not there for them. People that have autism do not seem to understand simple questions, simple tasks. These people may only repeat what you say to them verbatim. You say hello, they say hello. You say, how are you doing? They may, how are you doing? They may not even understand what you're telling them. So there's a problem with cognition, that is understanding. There's a problem with learning. There's a problem with socializing and interaction. They don't express emotions or feelings. And they don't understand people's feelings. That's what I talk about on non-verbal communication. That is communication like Like if I do like this, you already know what it means. Junior, I see you. You're welcome back. Sorry again. If I do like this, you know what it means. People that have autism do not understand those non-verbal cues, those non-verbal signals. Delphine, I see you. Welcome back. Please share, tap the screen. Thank you guys for coming back. These people are inappropriately approached. They may be aggressive, they may be passive, they may be disruptive. So if you touch a child or a person with autism, they can throw a tantrum. No problem is doing it. They can become very violent because they don't want to be touched. We are going to the course. We are going to the course. Big Mama, thank you so much, Ma. Thank you so much, Big Mama. Thank you for your time. This person has a particular pattern of behavior. He wants things done in a particular way. She wants things done in a particular way. There's a pattern of repetitive behavior. If anything changes from what the child is used to, there'll be a lot of problem. They have things like OCD, obsessive compulsive disorder. They want things to be done in a particular way. If you change their routine for anything, they would revolt, they would change. They like a particular color, they like a particular food. They refuse food that has particular texture. If the environment changes, for instance, light, sound, touch, temperature, you will notice they are changing character, they change in behavior. Good evening, Ransla, I see you. They don't want to engage in any play, any imaginative play, because they are focused on that one thing. They are so focused that they notice the very tiny details of an object. What you just look at and say, okay, this thing is red. They will notice, oh, this version of red, oh, this thing has an edge, it has a mark on it. And if anything changes around them, it usually disrupts them. These children or people that have autism, they have problem with coordinating their movement. So they don't walk like you and I normally. They may walk in a particular way. Remember, it is a range. It is not just one autism manifests the same way in everyone, in every child. Each child is individual because they have a range of symptoms. Why all these symptoms may be present, there are some symptoms that may not be present. Unique Pearl, I see you. Thank you for coming back. Amani, I see you. So, this person wants to do things in a particular routine, wants to eat a particular food, doesn't want a particular food because of the way it tastes or the way it feels, doesn't want lights to be changed, doesn't want, the environment to be changed. They notice the littlest details. For instance, if you're washing their clothes, good morning, Amani, I see you. If you're washing their clothes with a particular perfume soap, and that thing changes, it can throw the child into a tantrum. Because of the development of the brain has been affected when it was being formed. Good news though, as these children grow up, some children actually grow out of it gradually. It's not cured, but their social aspects usually improved. So they tend to go out more, they tend to socialize more as they grow older. Some. When should I be worried for a child, for a baby? By 6 months, this child does not respond to smile. Dr. Snowweezy, hey, happy new month, bros, I see you. By 6 months, this child does not respond when I smile to the child. Then I should be worried. I should go see a doctor and find out what's going on. When I smile to the child, the smile doesn't come. This child doesn't smile back by 9 months. So we're talking about developmental milestones now. Milestones are those steps of development of a child. By 9 months, you smile to the child doesn't smile back. You need to find out what the problem is. This child by 12 months, that is by 1 year, doesn't talk, doesn't make any sound. And him happening more, bros. This child doesn't make any sound by 1 year. You should go and check with the doctor. By 14 months, that is 1 year and 2 months, this child doesn't point or wave. You know, children now, bye bye, I want, give me. By 14 months, you should find out what is the problem and go and see your doctor. If this child doesn't make any sound by 16 months, doesn't say single words by 16 months, almost 2 years, that is 1 year and 4 months, it doesn't say single words. At that thing, you should be saying, mommy, daddy, come, leave me, go. You should see your doctor. It may be a feature of autism, maybe, but you need to go see your doctor for that. This child doesn't make believe or pretend or have an imaginary friend, all those little make believe plays that children do through toys, construction things, and by 18 months, you need to go see your doctor. There may be a problem. Doesn't say 2-word phrases by 2 years. The child is 2 years old, cannot say come here, cannot say I'm up, cannot say jump up. By 2 years, the child cannot say leave me, cannot say I'm here or give me. At the age of 2 years, you should go and see the doctor. Any time in the development of the child and that this child was probably speaking before and suddenly loses the language skill, that doesn't speak anymore, you should go and see the doctor. You may be dealing with autism. Now, somebody asked the causes of autism. I made a very short video earlier. The causes of autism is a mixture of the genetic and the environmental factors. An interplay between the genetic and environmental factors. Genetics, that is, there are some genes that may be defective when this child was being formed, which means this child also received defective genes, so it can be passed down from parents to offspring. So many syndromes, diseases, I will not be mentioning the name so you don't get confused. I try not to use any big words. But syndromes, a group of diseases, a group of symptoms, characteristics of a particular disease, as a result of the genes that the child received being faulty. So, it may be as a result of mutations of the genes, it may be as a result of faulty genes originally, and environmental factors. Now, research has shown, and we're trying to prove, if viral infections, medications, complications of pregnancy actually, or even air pollutants, actually play a role in autism. So the mother is pregnant, viral infection, pregnancy complications like bleeding, preeclampsia, placenta previa, all these things. Using certain medications in pregnancy, viral medications. It can be hereditary, yes. Most of the time it's hereditary. And sometimes it skips generations. That is, mom may not have it, but they'll tell you, oh, his uncle had it, or his dad had it, his grandpa had it, or his grandma had it, or his grandma on the mom's side had it, or someone in their cousin's family had it. So it may skip generations, but it's still in a gene. It's a genetic thing, it may not manifest. The environmental factors could trigger the autism. Let us know now that there's no link. Vaccines do not cause autism. We have looked at research results. We have looked at studies. Vaccines do not cause, because a lot of people say, oh, it's the vaccine I got. Oh, I don't want vaccines for my children to mess up their brain. Vaccines do not cause, at least to date, do not cause autism. So if you say, okay, you don't want vaccine, and you now expose your child to other infections, Dr. Felix, I see you. Vaccines do not cause autism. So, risk factors. What are those things that could make a person more at risk of having autism? What are those things that a child could go through, a mother could go through during pregnancy, during child development, by nature of the child that the child could go through? Number one, the sex of the child. Studies have shown that male children are four times more likely to have autism. So if you look at 40 children, you may have 40 boys with autism, 10 girls with autism. So boys are more likely, four times. So it's more often. Yes, that's what I'm saying, Femi Flavor. Thank you, Dr. Felix. Thank you, Amani. Thank you, everyone. It's more likely that the child that has autism will be a boy, four times more likely than a girl. I talked about genetics. If there's someone that has autism in the family, it's likely that they'll pass it down and they'll have another person that has autism. Remember, it's a genetic thing. The genetic aspect now interacting with the environmental factors, which I've mentioned before, can make the person manifest. So if the person has had a child, a woman has had a child with autism before, there's a likelihood she's going to have another child with autism again. So families who have one child with autism are more likely to have another child with autism. So the other disorders, Dunia, thank you so much. People that have certain medical conditions, there's something we call Fragile X syndrome. They bring out autism-like symptoms. So the more the modifications in the person's genetics for other diseases, the more likelihood this person displays features and symptoms of autism. Remember, I keep on saying it again, autism is a spectrum. Someone can be born and have little symptoms, have difficulty in communicating, have difficulty in posture, have difficulty in facial cues. Another person can have difficulty in touch or contact with others playing outside. So it's a spectrum from your mild to the severe, different modification. Thank you, Dunia. Thank you so much. Wow. So when there's Rett syndrome, for instance, Rett syndrome is a genetic condition that affects almost exclusively girls, and the head doesn't grow as fast as should. Remember, it's the brain that makes the head this shape. So if the head doesn't grow properly, the brain will not be able to expand and fill the spaces and grow properly. This person will have problems with the brain development. So Rett syndrome that causes slow head growth in children, in girls, will affect the brain development, and we are talking about a neurodevelopmental problem. A problem that started from the development of the brain. The ages of the parents. There's a connection between the age of the parent and the likelihood that the child is going to have autism. Research is still going on to give us, we know that women having babies from 35 years upwards are more likely to have children with Down syndrome. But research is going on to find out the link between an advanced age woman having a baby and autism. So there may be a connection. I can't give you definite results yet. We are still watching, we are still trying to study, we are still trying to read out materials. So now you know the cause. Now you know the symptoms. What are the complications? Because sometimes these children, these individuals may go through life with certain complications, with certain disease conditions, and you're wondering, what can I do to help? You've looked at the risk factor, the sex, the mother's condition in pregnancy. Was she having any infection? Did she use any medications? Was there anything that affected the development of the child in pregnancy, in utero? Did this mother have enough nutrition? That's why we say, look, when you are, I talked about pregnancy journey some weeks ago. Pregnancy journey, once you are planning to get pregnant, take your medications. Thank you. Take your medications, take your supplements, visit your clinic regularly. Folic acid, as little as it is, helps the development of the nervous system of the child. So, Hector, I see you. Complications, number one. This child is going to have affected developmental milestones. I mentioned this before. Cannot talk, cannot utter a sound by 12 months, cannot sit properly. At the age of 6 months, does not respond when you smile to him or her. At the age of 18 months, you smile and the child doesn't smile back. At the age of 18 months, you are trying to play games with the person with the doll and the child is looking at you like, okay, what are you doing? So you need to be careful, be watching for these symptoms. Now, problems in development in school. This child goes to school, of course, toilet training, developmental milestones, toilet training, dressing themselves up. All this will be affected. The way they walk, starting to walk, sitting without support. All these things will be affected. They go to school. The child is not learning as fast as his age mate. It should be a reason to worry. That's a complication of autism. This person even makes it through childhood, becomes a young adult, trying to get a job. They don't get jobs. People don't tend to employ them. That's a complication. Because I don't want to employ someone that I feel, remember, feel is not productive, is not going to be productive. I don't want to employ someone that I feel, remember it's feel, may not interact with other workers in the office. Someone that may throw tantrum if the laptop or something on the table is changed. You're welcome, Mama G. So, problems getting jobs, social isolation, complicated with social inability to live independently. So these guys cannot live on their own. At the same time, they want to be isolated. What do I mean? This person doesn't want any contact. The person probably has OCD, obsessive compulsive disorder. That is, don't change anything. If I leave my pen this way, it should be that way. This person cannot go to the market themselves. The person cannot take care of themselves physically. At the same time, when they need somebody, they don't want anyone to be around them. They want things to be done in a particular way. So it's a complex complication. They cannot live independently. At the same time, they do not want to socialize. So I left my wallet this way. It was aligned this way. Somebody comes and moves it this way. Remember, these people, they are so tuned that they notice the little change. Sunshine, I see you, welcome. They notice the little change. So if you move their object, or if you change their soap, or if you change their TV, or they change their food, or change their plate, there's a tantrum. So they cannot live alone, and yet they still want to be alone. You can see how complex that is. These people will be victimized or bullied. Society has not understood the fact that these people may even be superior to regular people. So they bully them because they are different. They victimize them because they are different. Stigmatization is still a real thing for people that have neurodevelopmental diseases. Cerebral palsy, epilepsy, autism. People still ridicule them. People still make fun of them. People still bully them. So, yes, Dr. Felix, yes, I mentioned that earlier. These people have attention deficit. They are easily distracted. Remember, I said it's a range. So why some people are focused on one thing, they notice the differences. Another child somewhere cannot even focus on one thing. He's distracted, he's moving up and down, his eyes are everywhere. These people are a stress to the family. I don't even want to begin to explain that. These people need extra care. They need extra attention. They need someone to be present at every time. Imagine a mother that has to work or take care of other children, has to focus on this child. This child throws a tantrum, and the whole family is stressed because of that one child. How can it be prevented? How can you prevent autism? The truth is, I can give you ABC ways to prevent it, but sometimes you cannot just tell. You cannot tell in the gene which child is going to be autistic until you start seeing the symptom. So, there's no way to prevent it. We can say, okay, make sure you marry early, but remember, it's a genetic thing. We can say, oh, hey, Paula, you came very late, very, very late, and I delayed for 2 hours because of you. So, we can say, oh, marry early. Oh, look into people's families. Those are some ways to prevent it. Exactly, Delphine. That's why I said it's a spectrum. Not everybody will manifest this disorder the same way. Each child is unique. So, early diagnosis and intervention has proven. But Paula, oh sorry, I didn't know you came earlier, but I shared to you earlier though. Christine, I see you. So each child manifests uniquely, and one thing you should understand that this disease or this disorder that I mentioned, all these features will not all come in one person. There are modifications, there are mildness, there are severe one. Paradise, I see you. Wagwan, sister. So one thing that society should learn from these people is that these people have attention to detail. They are focused. We are playing my music, I want the music to play this way. You bring my food, I want the food to be arranged this way. Don't change anything around me. While, of course, on the other end of the spectrum, those ones cannot concentrate. Anything just distracts them. I'm driving to work, or I'm walking to my house, and suddenly I see a butterfly, and I just turn and start following the butterfly. I forgot where I was going. It happens. So, early diagnosis prevention, go to your clinic. Speak to your doctor when you notice all those things I mentioned earlier. And start therapy as early as possible. Behavioral therapy, speech therapy. Exactly. Femi Flavor, remember I said that as these children grow up, some of them are better with socializing. Some of them. So I have friends that have children that at the age of in a relationship now, they have boyfriends, they have girlfriends. With support, with proper monitoring, with proper follow-up, these people are able to lead a normal life. Yes, it may not be as easy as the regular me and you and the other people that don't have autism, but eventually, gradually, they will be able to integrate with constant support, with constant attention. Miss Butterfly, I say you're welcome. They will be able to integrate and move into society and be accepted and understand the society. So, how do you diagnose? Remember I said if you notice A, B, C, and D, this child is slow in school. This child is not walking at the right time. This child is not speaking at the right time. This child is not smiling or showing facial expressions at the right time. It's time for you to go and ask your doctor, doctor, please check this child. What's going on? Interact with your child. It's your family member. Interact with them. When you notice there's a problem in social interaction, it's time for you to raise alarm. Most cases parents reach yourself because they don't have knowledge of exactly. If all of us understand it and understand that these people are just unique, the fault is there, but we can bring them out gradually. Remembering the premise that I said there's no cure. I'm fine, thank you, Miss Butterfly. So, make sure you communicate with this child. Expose the child to as much of the environment as you can. These children need extra attention. So you have to give them dedicated time. Yes, it's genetic, Mama G. Mama G. Lockdown wouldn't help. So give your child tests. Cover your ear. Give short commands. How does person relate? Or how is person in school? Does person behave? Does person throw up tantrums? Those are the things that you know that, oh, this child. You speak to the child and the child only repeats what you say. Repeats what you say in a monotone. Baby, how are you? Baby, how are you? You call it a robotic kind of talk. They don't initiate conversation. Most of the time they only point to what they want or they only say what they want. Give me. That repetitive movement, yes. Head banging is usually, in fact, we have many people that have autism that have to wear helmets. It may look ridiculous, of course. It will become a thing of insult. It will become a thing of ridicule again, another stigmatization point in the environment. Because head banging will cause a lot of injury. It will still affect the child again, the brain, a lot of moving around. Everybody's looking around and looking at, okay, what's happening to this child? Attention is drawn. Oh, that child is mentally retarded. Words like that. So, you want to support the person. Dr. Chimzi, I see you. So, see your doctors. You may need to get speech therapists. Interact with family members. Let everybody be involved. Mommy alone cannot be taking care of that child. The older siblings should be involved. The dad should be involved. The environment, the social aspect of the person. I feel you, Dunya. I understand you, Dunya. So, when you have gone to the clinic, the doctor too would want to do, okay, is there a genetic test for Rett syndrome, for instance? I mentioned what Rett syndrome is. Slow development of the head, affecting the brain's development too. So the doctor will want to do other tests. Is it Fragile X syndrome? Is there Rett syndrome? Are there other diseases that are going on at the same time? What are the physical complications or physical manifestation of this disease or this disorder? And for treatment, remember, no cure exists. Therapy, exposure, social therapy, a concerted effort of all your specialists, your neurologists, your therapists, your child care individual, your teachers in school. Everybody has to come together to make sure that this child gets a healthy, robust, and stress-free environment. With all these concerted efforts growing up, this child will be better adapted to the environment. You cannot give up. You cannot say, oh, I've tried my best. Remember, this is a life. Thank you, Dunia. This is a life. This is an individual. If you study that child properly, you learn one or two things from that child. The way the child observes things, the way the child does things in a particular way. Society can learn so much from the way autistic people see the world. These people are special needs people, but many of them are actually at a higher reasoning level, an analytical level. The way they sort problems, the way they tackle challenges is something that we all could emulate, could learn from. So I will not be mentioning drugs because I said family therapy. Everybody in the family should be involved. Educational therapy. There are special educational materials that will attract this child's attention and help them understand the world around them. Behavioral therapies. There are specialists that do that. Other therapies include speech therapy, physiotherapy, Do you help this child move properly? And please, for those people looking for a microwave method, from my research, from my study, no medication can improve the symptom of, or can improve autism. It may give medications to calm them down and the rest, but doesn't cure, doesn't modify the genes. I wish with this few points, I've been able to talk about autism in detail, unlike my video that I put earlier. I told you guys there's going to be a lot of meat and flesh in this live. I'm sorry again for coming late. I had to attend to my driving lessons or driving school. So we've talked about autism spectrum disorder. We said it's a problem with the development of the brain. We said that the causes are okay. We said the causes are both genetic and environmental. The genetic causes there passed down from parent to offspring through the family. The environmental one triggering the genetic causes. We said that the features, the symptoms are so many, and we call them a spectrum from mild, moderate to severe. And some of children may have some symptoms, some may not even have those symptoms. For instance, them not able to concentrate, while some other people will be concentrating solely on one thing. They do not want their toys to be tampered with. They do not want their items to be changed. They don't want the environment to be changed. These people do not like physical contact. These people do not look you in the eye. They're always looking down or looking away. These people cannot initiate conversations. Some of them do not talk properly. They do not walk properly too. These people have a unique perspective to life. They don't want anything around them to change. And if anything around them changes, they can throw a fit, they can throw a tantrum that can destabilize everybody anywhere at any time. We have said that there's no cure. We have said that boys are 4 times more likely to have it than girls. And girls that have it are more likely to have Rett syndrome, that is a difficulty in a delay in enlargement of the brain of the skull while the child is in pregnancy or in utero. We have said that this child needs the effort of everyone in the environment, the specialists, the family, the school teachers. We have said that this person needs to be seen as an individual. You don't lump them and say, okay, this group of people have autism spectrum disorder. No. And preventing. Okay, we also said that we are looking at the likelihood that women that are older, advanced age, having babies, are more likely to have children with autism, like it is in Down syndrome. So everybody's hands will be on deck, at home, at the workplace. Typical, I see you. These are children with special needs. The government gives them special preference. Yes, you said that before. Oh, Shiblikola came at the end of the session. So, autism spectrum disorder is what we've discussed. Thank you everyone for being here. I'll take your questions now. Questions. Shipley was here earlier. She had to go attend to Little Princess. Thank you everyone for the live goal contributions, for the gifts. I'll take questions now. We've discussed autism spectrum disorder in detail. It's for each question so that we don't get it.
Good evening, Doctor.
Good evening, Mr. Femi. I see you.
I'm so much happy with this live stream. It's been educative and quite informative. These are the kind of things we really need, because it cuts across all boards. Because, like they say, some others have them. We cannot shy away from it. And the area the area I just want you to, though you talked about it, and the area that piqued my interest is that area of age, because from the little knowledge I have about autism, about Down syndrome, because I'm someone, though I'm not a doctor, but I do lots of research when it comes to health and other things.
Mhm.
Sometimes when I talk to our ladies, that it's not quite, it's not healthy for a woman to have children in a later age. Some of you need to see the outburst. You know, I don't just get it. That they will not, they'll be telling me, what about Sarah that had a child at 90 years? I do tell them this. How do you even believe that? Even these are stories that we are told. You understand? But I like dealing with reality and fact. I don't comment. I don't. Those are tales. So what I'm trying to say in essence is that we need to educate our women the more, because these are some of the reasons that causes these things. And secondly, these children, like you said early detection,
Yeah.
but is it possible to is it possible to be detected why the mother I mean, why the mother is going through, is going for antenatal? Can it, why still in the womb? Can it be detected?
Okay,
Is it possible?
so you mentioned, if you've given me two questions. So thank you, Mr. Femi.
Okay.
Um, One, remember I said when I was talking about the age part, I said research is still going on. Even I want to know the relationship between age and autism. Remember, it's education, it's an genetic thing. Dunia is getting to my head. Remember, it's a genetic thing. It's a genetic thing. Age is only something that people are looking at now. I did not say, yes, fix that age. No. I said the likelihood. We are looking at the relationship between it. So, age is only a likelihood. And I've seen comments already. Um, when this woman is growing older, there is so much activity going on in this woman's body that the genes, the genetic material in what she's bringing out can be mixed up such that she has a child that has Down syndrome. That one is established. Women that are at 35 years and above have a higher risk of having Down syndrome. But Down syndrome is not what we're discussing. We're discussing autism. Autism is genetics. Parent had it, grandmother had it, it was passed down. So look at Delphine now. She said he had a son at 24. So you can see that it's not an age thing. And everybody should be educated. The whole family should be involved. Everybody should be involved. The family, the mother. I shared a video where the mother was having a fit and the child or the children were the one that pulled her out of it. Everybody should be involved. The father, the mother, the neighbors, the school teachers, then the siblings. They should all be involved. Um, yes, I have a request. Before I take your request, let me answer some of the questions. Okay, Dr. Felix says age is not absolute. Once you have the genetic mutation, the children can have it irrespective of age. Exactly. Um, it's not just women that need it. Okay, yes. I would say age causes it, even younger parents. Okay, I wouldn't say, okay. At what age does one get diagnosed? See, I said it before. When you are noticing this child is born, he's not crawling at the right time, he's not sitting at the right time, he's not cooing at the right time, he's already 1 year, hasn't said a word. You smile at 6 months to this child doesn't know what you are doing or doesn't imitate your smile, doesn't respond. You start to worry. That's the time for you to go to your clinic and check on this child and see. Dr. Felix, you want to come up? Delphine, I see you.
Good evening, everyone in the house.
Good evening. Good
Good
evening,
evening,
everyone.
doctor. Mm.
You're welcome.
Hi, doctor.
Good evening. Please, let me take Coreti's question because she asked first, and
No,
then
yeah, no, I was just I came up for the guy that was here before. He was talking about Down syndrome, but you're talking
okay.
about autism, yeah?
It's autism we're discussing, yes.
Yes. You know I work with autism, yeah.
Okay,
It
nice.
was interesting. I think probably a biggest awareness of autism people need to realize it's not a disease. You know what I mean?
Yeah.
Because a lot of people see autism people is like a disease, but it's not. See, it's a lot of autism is not really diagnosed until probably later on in a lot of children. Doctor, do you agree with me?
So that's why we're doing this. I've brought out highlights where
Yes.
you can go in and have your child examined and checked. I
Mm.
said it before. I use the word disorder, not disease.
Yes.
Disorder that if there's an order of genetics, there's an order of things the way it should be. Now these
Mm.
people have order misplaced or displaced. That's why they're
Mm.
having such manifestations. And one child is different from the other child. If it's a disease, almost every child will have the same symptoms. It's
Yeah.
a spectrum.
Mm.
So thank you for
Mm.
clarifying that. Thank you for clarifying
Yes,
that.
yes, yes. And another things we need to realize that autism, a lot of that's why a lot of them they don't finish school until 21 because of the development of their brain. Like even though they might be 21, but uh the development of their brain is still at the age of 5, some of them. You know what I mean?
Yes. So we've talked about cognitive impairment. The uptake
Yes,
of
yes.
learning skills is different. But unfortunately, people overlook the fact that people that are autistic, they have their own way of learning. If you can
Mm-hmm.
tap into that, people will pick faster than the regular people.
That's right. They pick when they focus, the beauty about autism, when they focus on something, they are very focused. You know what I mean?
Yes. While
They
some
are
people will
very,
have ADHD, have attention deficit activity disorder.
yes,
Good evening,
yes.
Sherry Coco. Sorry,
Okay.
your 2 minutes is up, Coriti.
Oh, is it only 2 minutes? Do you only allow 2 minutes these days? What the
Yes,
hell?
just 2 minutes. I have people in the comment. I have people that want to come up in the request.
Okay then. Okay. Okay.
Thank you so much.
Honestly,
Thank you
this
so
is
much.
time limit
Thank
business,
you so
huh?
much.
Okay
Thank you
then,
so much.
doctor. It was nice seeing you.
Yeah, it's always a pleasure to have you here.
Okay. I'll
Sorry,
see you later.
before Dr. Felix comes up, please, Delphine, you wanted to say something.
Yeah, I wanted to say that good evening everyone. I have my son. My son is 15 years now and
Okay.
he's autism, but you can't see it, you can't know except if you stay with him. He's
Yes.
some he's somebody he's more in details. You understand? He dictates but
Yes.
details. But when he
Yes.
was still a baby, there were this all these sign that you mentioned here, but I me like a mother, I didn't know what that was because the his twins is with the sister, and I didn't I was so young then. My son
Mm.
refused to eat food from the pot, cooked food, for 1 year. When he was 1 year to 2 years, cooked
Oh
food.
my God.
Yes, any food that is like warm food for 1 year, nothing like fruit. So
Mm.
those are the signs that maybe most parents you can notice from a child, but you ignore. You will just be thinking that, oh, this child is stubborn, or the child is this, the child is that. Those are the signs that But because we are ignorant about it, we don't have any knowledge about that. We just
Mm.
it escape our. We
Madam
neglect
Delphine,
it.
let me add to your the symptoms. Do you know that a child that has autism, if you serve him with red plate usually and you change it to blue plate, he can throw a fit.
Yes, like my son, you see these
So
bones. These buns that we fry, now these buns, before
yes,
when he was little, if you fry that buns and it is not well round without any that it needs to be just like a ball without no
Yes.
horn on it. Yes, he will not eat it.
Oh my
His
God.
shoes need to be perfect. His room clean, all his clothes bent. If not, he won't be. Yes. And they are very lovely child. Even right now, he's very intelligent, but he has focused, he has put his focus, I want to do this. So you cannot change his brain. Even the teachers, the principals have called me. This child doesn't supposed to do technical. Why is he doing technical? He's more intelligent than what he's doing. He said he want to do better. So he has been like in 3 different schools. They have put me with him on a round table to divert his mind. It's not possible.
So I appreciate the effort you are putting into raising an autistic child, and
It's not easy. It's not easy. It's a heavy job. It's
yes, I
really a
understand.
heavy. It costs a lot of energy, a lot of strength. Financially, it drains me financially. It drains me emotionally. It drains me physically. Yeah.
So yeah, thank you so much, Delphine. Thank you so much, and I
Thank you.
appreciate you coming here and sharing your story with us. Your 2 minutes are up anyway, but
Thank you.
please keep doing the amazing job. I'm sure you reap the benefits. I'm sure you enjoy your son or your child. I'm sure that you see
Man.
the way to look at life, the way your child looks at it. You will learn 1 or 2 things from him or from her.
Yeah, for sure.
Yes. Thank you
Thank
so
you.
much. Thank you so much.
Yeah, you're welcome.
Dr.
Yeah.
Felix, you want to say something, Dr. Felix?
Yes, my brother. First of all, good evening to you. And Dr. Temi,
Good
I
evening,
want to
sir.
thank you so much for this section. It's been a very fruitful one, and I congratulate you on that. And thank you so
Thank
much
you, sir.
for having the discussion. Kudos to you.
Yeah.
I want to ask, how many of us here have watched or seen the movie The Good Doctor? Anyone in the comment section who has seen the movie The Good Doctor?
I think
Yes
I've
or
seen
no?
it.
The Good Doctor. Dr. Temi, have you watched that movie?
I think
The
I've seen
Good
it, yes.
Doctor.
Yeah.
Yes. You see, that is a classic example, and that movie was based on a true life story. The mere fact that your child is autistic does not mean that he or she cannot make meaning in terms of life. It's all about identifying the potentials of the child and not trying to change what he or she wants to do. Once we are able to know that my child is autistic and these are his or her inherent potentials, and then you try to help him. The mistake some parents do why autistic children, some of them suffer, is that they try to change them. You have to remember that autistic children, one of the main issues they have, like Dr. Temi said, is OCD. And once they become obsessed with a particular thing, when you try to change their brain or tune them away from it, you are going to break hell loose. And once you start doing that, you are going to even worsen their symptoms. So please, the parents here, if you have such an autistic child, please just study them. Autism, though it's a spectrum, trust me, the very few kids that I have seen, they are very intelligent. If you are able to help them and identify and shape them, they become very, very. And Dr. Tommy Tope, not like just saying, I have a doctor friend, he's autistic. Yes, he's an autistic person, but this guy has even gone ahead to specialize in obs and gynae. Because the system was able to identify him, the parents were able to identify him, the medical school were able to identify him, and they created the enabling environment. To every parent here, please, if you have such a child, give him time, study the child, look out for the signs and symptoms. What does he like? What doesn't he like? Once you are able to fit yourself into the shoes of this child and you don't counteract whatever this child are, trust me, you are going to help this child, and this child can also become meaningful and make impact to our society. So kudos to you, Dr. Tomitope. Thank you
Thank
for
you. Thank
this
you.
opener. It's been so good. God bless you.
Thank you, Dr. Felix. Guys, it's only Dr. Felix that is not subject to my 2 minutes rule. Oh. So everybody else is 2 minutes. Sherry Coco, I see you. Sherry Coco, you have a comment?
Good evening, sir.
Good evening. How are you doing? You're welcome.
Well, what I want to say is different. It's not on what you say. I want to ask a question. You know, I asked you a
Yeah.
question yesterday about tuberculosis, which
Yeah.
I thought that
But
somebody has tuberculosis without knowing,
okay. Okay.
and the person was test positive. And later
Okay.
on, they actually want to know maybe the person is coughing. You know, the person doesn't know that she has and she's not coughing. So they want to know maybe the person is coughing. You know, they will ask her to cough to cough
Produce
out and put
photo.
it inside for them
Yeah.
for test. Yeah, thank you. I forgot the name. So, but what about if the person has when she wanted to do it, or he or she want to do it, she has a sore throat during that time when she's bringing this thing. I hope it soon show that the person is coughing during that time.
Okay. So whether the person has sore throat or doesn't have sore throats, the what they test for in the sputum for tuberculosis is specific. So there may be other things, but what they use to test for tuberculosis in the sputum, we will find out if tuberculosis is there, whether there's sore throat or not. It will find it out. It's a
Okay.
specific thing that is tested for. I'm trying to be as simple as possible. It's specific. What they are using to test the sputum with is specific. The acid fast bacilli is specific to tuberculosis. So there may be other bacteria there. But once that AFB shows that tuberculosis is there, treat the other infections, but tuberculosis should be there and it will be identified and it should be treated, as I mentioned last time, 6 months. Yes. I hope that answered your question.
Thank you. Yeah, that's all. Thank you.
Okay, thank you so much. So back to autism, guys. Yes. OJ, you mentioned fish oils. Remember that when this child is formed, the brain cannot be edited, especially when it's a genetic problem. Fish oils may also help in some other parts of the body. The brain, no, I'm home. Okay, Kentita, I see you. The brain does not replace itself. Exactly, Dr. Felix. The brain does not replace its cells. Fish oils, omega 3, will help with fat regulation in the body and other things, but not the brain. The brain will not. I'm giving you science. I'm not giving you what I heard. So the brain will not reset itself, will not add to cells. The cells that you have as an adult are the cells that you brought when you were a baby. Nothing new is added. Who's this person now? So please, let's not. Omega oils help for blood circulation and some other things, but not for autism, not for brain development. I hope we got that. Okay, Dr. Felix wants to come up again. We're taking questions. We've discussed autism. Taking questions. Yes, sir. Exactly. I don't know what's going on. Can you hear me now?
Are you
Can I?
using Bluetooth earpiece, Dr. Temi?
I'm not using my Bluetooth. I turned it off at the beginning of the live. I'm not using a headpiece. Okay, they said
Guys,
they can
can
hear
you
me,
hear?
but not the box. So I had a phone
Can you
call. I
guys
had a
hear
phone call
me?
that I ended. Maybe that's what caused it. But I think it's fine now.
Okay.
So Dr.
So
Felix,
I was
sorry, I
trying to
apologize. But can you take it again, please?
Okay, please. I was trying to tell OG that the statement that fish oil will help the brain to develop, right? It is not true. Let me relate this to CP or cerebral palsy. When you take children with cerebral palsy, the injury that has happened, okay, that injury can never ever be corrected. And therefore, as this child is growing, any part of the brain that has been destroyed right from infancy, it can never repair. So therefore, the symptoms of the affected area of the brain is going to manifest. When you bring this to autism, a similar thing that is happening. The mutation or the chromosomal issues at the cellular and the molecular level. Because of that, you can never, there is no medication that is able to go and correct genetic or chromosomal issues that include the fish oil. You understand? So don't let anybody lie to you. If the child is improving, it's not because the fish oil is actually helping the brain to correct itself. No. He's benefiting because the omega-3 fatty acid has other beneficial aspects to the human body, but not necessarily because it's helping the autistic brain to reset itself or to regrow. That is what I want to add.
Thank you so much, Dr. Felix. So that's like I said. This problem is at a genetic level. When I say genes, the genes are those codes that the body uses to form the eye, the brain, the mouth. So it's written in the code. There was a problem in the code. So your fish oil cannot go and rewrite that code. Once the brain is formed with the problems the way it is. You're welcome. So there's no 1, 2, 3 medications exactly shapely. It's not a disease. So you cannot say you want to cure something that is not a disease. It's a genetic disorder. There's an arrangement of cells that made me the way I am. There's an arrangement of cells that makes Shapely Cola the way she is. There's an arrangement of cells that give me big cheeks. There's an arrangement of cells that give me dark skin. Once that arrangement has been affected, for instance, albinism, you cannot now give one tablet and say you want to change that order. I hope you understand it now. And I said it in my video the other time. I said, look, some people believe that, oh, it's because of bad parenting that the child became autistic. No. So parents should stop looking at it like, oh, it was my fault. Because I beat this child, or because I did this to the child. Thank you, Ransler. Or because I behaved this way to this child. That's why this thing is a genetic problem. And once you know that it's a genetic disorder, and we have explained what cerebral palsy is, what autism is, you should begin to look at it with a different view. Mami, what I see you. Happy New Year. And understanding that this child needs a unique, you cannot treat this child like every other child. Yes, children are unique, but children that are autistic are super unique. They need super attention. They need super specialization of care. This child doesn't want hugs like the other child. This child doesn't want you changing things around them like the other children. So you have to be careful. Thank you, Jesus died to save you. I see you. So you have to be specific. And that's why we say this puts stress on the family, especially if the family is not helping to take care of the child, as only the mom or maybe just the sister. We said also that if you have one autistic child, the likelihood for you to have another one is higher, and it keeps on increasing with the number of children you have that are autistic. So you want to take a break. You want to understand your own genes yourself. You want to speak to your doctor. You want to sit down and talk about all the risks that you'll be going in for having another child. So questions. I like the way we're taking this conversation. If you have any questions,
Yeah,
please go
Dr.
on.
Femi.
Yes,
Whilst
sir.
we wait for another question, I like to also say this. There was this guy who came first, I've forgotten the name, where he was talking about the brain and the age, and was advising the women that because of that, they have to marry early and all that. We have to understand that if, for example, as a woman or a man, you are carrying the autistic gene, okay, the mutation or the chromosomal or DNA misarrangement, it doesn't matter the age that you give birth. If you are 18 years and you're already having the gene for autism or the mutation from autism, okay, you can have child at 18 years and then you end up giving birth to an autistic child. And it's not only about women. When we are talking about age, it's the same thing for men also. As a man also, the older you get, the higher your risk of having children with genetic or chromosomal abnormalities. So we shouldn't only be saying that it's just about women. It goes both ways. So the men also, we have our share. But once you have a genetic mutation, irrespective of the age, you can still pass it on to your first, your second, or which order that it may happen. That's what I wanted to add. Thank you.
Thank you so much, Dr. Felix. Mama G, I see you. You're welcome.
Hello.
Hello.
Hello. Don't. So my little boy is 2.5, and I noticed he was different at 18 months. So we're going through the process of an assessment. Obviously, you can tell I'm in the UK, so it might be slightly different. So basically, since that time, I've spent endless days learning autism. I've learnt loads on TikTok, etc., etc. And I realised that ADHD, it kind of comes hand in hand, but I didn't know about the OCD. So when you said that earlier, literally a light bulb went off in my head, because that makes so much sense to me. So my question is there anything else that goes with it that I should look out for, that I could then learn to help understand, his ways?
Unfortunately, you will have your course set before you. Look closely, more closely. You will see things that you can learn. ADHD is on one end, while OCD is on the other end. In between ADHD and OCD, there are so many things in between that you can learn. Observation, someone has said it, observation is the best way.
Yes.
I may give you 100 things and you may not have any of them. That's why we say it's a spectrum.
Yes.
So all what I listed, developmental milestones, problems in interacting, your child may not have all this. It's now for you to look closely. You're doing a beautiful job already by identifying that there's something different.
Yeah.
But you keep on studying and observing. Sometimes you have to draw closer. Sometimes you have to look back. You have to move back and watch from a distance and see the peculiarities in your own offspring, in your own child.
Okay. Thank
Yes.
you.
Dr. Temi, let me add something to that, please, if you don't mind.
No, go on, please, sir.
Yes. So, like we said, those children, we use the word they are special, children with special needs, or they are special. But I want to also let you know that within them being special, we have another subspecial within them. What do I mean? Every autistic child is unique in his or her own way. So the fact that the child is autistic does not mean that if Madam A also has an autistic child, the same thing that he has, just like Dr. Tommy Tope said, you are also going to say your child must also have it. Because this autism, it comes in different degrees. Some of them have it in a milder form, others moderate, others severe, just like CP. So it is up to all of us. If you think that your child is autistic and he goes through and then he's finally diagnosed autistic, you have to now look out for the unique things that make your child special in his or her own way, because that specialty is what you can use to help him, and not what the internet or you saw another autistic child. Your child is going to be unique from another child B. Thank you very much.
Beautiful. That's exactly. He said it better than I could have ever said it. Correctly said something. I want to quickly highlight that. These children, most of the time, if they talk, they only point to what they want and what they want to do. So if you want to communicate with them, don't use long sentences. Come, take, eat it, hold it, give me. You can start with that. Your communication with them should be direct. It's not a time for you to start giving metaphors and similes and proverbs. I hope Mama G, your question was answered.
Yeah. I think you just have to remember you're coming from a doctor's perspective. Do you know what I mean? Like, as a mother,
I know,
and I'm
I
not
know.
saying anything bad, not at all. I've learned so much from you, but as a mother, you do go hell for leather. But I've learned from you guys to take a step back and let him teach me. Is what I'm trying to say.
True, true.
But
The
thank you
mother's
so much.
perspective is usually a different view. There's a
Yeah.
lot of emotion, there's a lot of protection, the mother hen kind of figure, there's a lot of worry. So I understand the mother's perspective also.
Yes, thank you.
And we can only work together. Like I said, everybody has to be on their toes. The teachers, the siblings, the neighbors, you yourself, the parents. All these things come together. Even the child has to be on the same page as you when we are trying to bring this child up. And everything would work together for the best of the child. And you'd be proud of that child.
Yeah, absolutely. I'll drop before they start shouting at me for having longer than 2 minutes. Thank you so much. Thank you. I'll be in the
You're
comments.
welcome. You're welcome. Okay, no problems. Nadine, I see you. Happy New Year. My son used to sign and use specs. Now he talks, but also has a stammer. With time, with exposure, with your love, attention, everyone around working together, this child will grow. It may not be as fast as the regular or the other children. This child will live out of it. I know someone that we all know, we both know, Dunia. Her daughter is 19, she's dating, she's autistic. She's already dating. So life goes on. Dr. Felix mentioned a medical doctor, a specialist that is autistic. So life goes on for autistic people. All we have to do is to understand that their lives are special, and we need to upgrade ourselves to their level of reasoning, their level of analysis, their level of observing problems and tackling environmental problems. Thank you. Nadine, I see you. Kina Michelle, I see you. You're welcome. Guys, questions. That's why we're here. It's past midnight for me. I've been here for 2 hours and 4 minutes, of which 1 hour of it was used on the road. So we've talked about autism. I hope I've been able to reach out to one person. Yes, Paul, I see you. I hope I've been able to reach out to one person or two people today, because that's my goal. That one person that says, look, doctor, what you said makes sense. And I learned from it. Yvette, I see you. Welcome. Sorry, your name is so tiny, I can't even see, even with my glasses.
Jim Keys.
Tim
The name
Keys.
is Jim Keys.
Okay. So you have a question?
On health, right?
On autism. We've discussed autism, yes.
How do you say? Hello?
You have 2 minutes to ask a question on autism. We've discussed autism for more than an hour. You have any questions?
Okay. Actually, I want to ask a question on. I was having issues in my jaw. I was having like an ache in my jaw, and I used pain relief, and I was thinking to go away at least after some days, but the pain persisted for close to 2 weeks. And I've been trying, and whenever I have issues like that, I just try to make some research. They're like, I have something, maybe I've forgotten the term they used with my jaw. So
Okay.
sometimes the pain, sometimes after using this pain relief, the pain will reduce. Then after some days, it will persist again, and it will come with full force. So I don't know what's wrong.
So Tim Keys, you're in the wrong place. You're supposed to go to the doctor. You've used your medications for 2, 3 days, it's not working. Please go and get examined. Don't go and Google the problem. Your research is on internet. Please go to the doctor. And I God, I take beg you so that you don't find out late. Please.
Okay.
Stay famous. I see you. Thank you. Thank you so much. Thank you for coming. Thank you for your question.
Hi, Doc.
Berry, I see you. Welcome.
Thank you, Doc. Good
Yvette, send
evening.
your request. If you want to ask a question, just send a request. The lady, Dennis Francois, I see you. Yvette, you have a question? Send your request. Berry, I see you have a question for me.
Yeah, I have. Sorry for taking you back. I joined late. I wanted to know there's always this thing they say like if you get married to your cousin like same genetics, it does it is it is it or is it are there greater chance of giving birth to an autism child?
So I don't understand what you mean by
The
genetics.
chances they have, what are the chances? What are the chances of giving birth to an autism child? Like if you get married to your cousin, same like relation, your close
So
relation.
okay, so what you're talking about is inbreeding. That's the
Yeah.
inbreeding, that is marrying close relation. Remember that
Yes.
autism is a genetic thing.
Okay.
Hope you understand that it's genetics.
Yeah, I
Now,
do. I
remember
do.
that genetics are passed down from mother to child. Now,
Okay.
imagine if grandpa had genetics,
Mm,
had autism, and has the gene for it,
mm,
and he passed it down to all his children. Now, his grandchildren now went to marry another grandchild that has autism. Don't you think the risk could be higher?
mm.
So it could be higher. But
Yeah,
it's a very rare case.
sure.
But usually, if the autism is passed down, it will be higher, definitely. I hope that answers your question.
Yeah, but they keep saying like you see, like in this God country where we are, right?
Oh, sorry about that.
You know, as in Jesus' history, like there are some traditions whereby you get married to your cousin, sister get married to the like first cousins. Then I see they're always autism children in those families. Too much. I don't
So
know.
what you're describing as autism may not be autism. It may have mental disorder. It may have mentally challenged people. May have some other diseases as a result of inbreeding. That's the raw term for it. It may not be autism.
Mm,
Yeah. So
okay.
autism has to follow a specific order and have some of the features you mentioned.
Okay.
Yeah, so it may not be autism. If you look closely, you may have Down syndrome, you may have trisomy,
Mm,
you may have Edward, you may have Patal, you have so many other chromosomal problems, but may not be autism. But if, of course, like I described, if grandpa has autism already in his genes, he could pass it down to his grandchildren and everyone, and they marry each other. Two people having the gene coming
mm.
together may manifest, may. So I hope that answers your
Okay.
question now.
Yeah, yeah, I'm clear now. Thank you.
Yeah, thank you, thank you. Yes,
Yeah.
we have another person. Best the best. I see you. You're welcome. The people in the comments are just doing their thing.
Hello? Hello, good evening.
Hello. Good evening. You
Yeah.
have a question on autism?
No. I was going to ask something else. I don't know if I can talk now. It's not about autism.
Well, we are talking about autism. So you have 2 minutes. Go on.
Okay. My partner snores, and I don't know what to do.
Okay, so some of the things that can cause snoring. Number one, sleeping in the wrong position. Number two, being overweight. You're not listening. You're already bringing noise back into the live.
My television. Can you turn down the television, please? 1 minute. Let me turn the television down.
You have 1 minute. So I'll answer your question while you're in the comments. Thank you. Your husband snores. What is causing the snoring? Snoring is happening when the airway is obstructed intermittently. So does he have an upper respiratory or lower respiratory tract infection? Does he have something that is obstructing the airway? Is this person overweight? Is this person sleeping in the wrong position? Is he stressed? Sometimes you need to modify the person's behavior, this person's routine. Someone that just written the complication of that. Complication of snoring could be sleep apnea. Could be. So go and see your doctor, have the person examined. If it's overweight, adjust the person's weight. Sometimes I snore. My wife does like this to me. And once I change, the snoring stops. So maybe the position of sleeping, maybe that the person is overweight, maybe that there's something going on in the airway. Go to the doctor, examine, and you get your solution. Exactly, tonsils, inflammation in the airway, weight. Why you guys are kicking each other on the bed? Nobody will sleep in the end. Then problem now starts from stress. Thank you, everyone. Thank you, everyone. Questions. Can I take one more question on autism? We've done well on autism. Yes, sleeping position too. I appreciate everyone that has been here on autism. Dr. Felix, thank you so much for honoring my invitation on a short notice. Thank you, everyone. We'll take just one more question on autism, or if you don't have any, Dr. Felix, do you have any parting words for us?
Yes, I think that once again, let me say, Dr. Temi, I told you earlier, but this has been an amazing session, so kudos. I'm happy that I came in, so keep it up. To all of us here, before Dr. Temi Topi takes over the platform, I just want to say this. Autism is around us, but when you see them, please remember they are special, okay? They are special. For you to be able to understand them, don't try to create a different path for them, but rather try to fit your path in their path. That is the only way that you can be able to understand an autistic child. If you try to correct them, do the correction according to how they want it to be done. Once you're able to do that, you are going to be able to help them. And also remember, we have mentioned that each and every autistic child is unique in his or her own way. And therefore, study that uniqueness in the autistic child that you have. Don't compare if you have an autistic child to another autistic child, because they are two special people with different special things that can come up. So please, and also let's remember that they are not disease. It's just a disorder. It's a form of malformation. Things have not been done well the way it's supposed to be organized. And therefore, don't see them as disabled children. I have seen a patient once a while where the children, they were eventually taken to the orphanage because the parents felt that they were too troublesome for them. And they were even calling them, they were what? In Africa, they have some name they have for them. So they went and dumped them, yes, in the orphanage, until some of us have to get in the social workers and we brought up those children. And those children currently, they are doing well. Don't leave your child because he or she is special. Please, please pay attention to them, learn from them, and fit inside them, and you'll be able to help them. Thank you very much.
Thank you so much, Dr. Felix. Mama Isusa, I have a question. How can we protect our autistic kids from an intolerant society? Education, education, education. You are the mama bear. Thank you, Moroccan Queen. You're the mama bear. This child is your ward. Do what you can to protect this child by all means. Shield them. If it's that you should protect them from going to certain places to play, please protect them. If it's that you should involve the teacher and call the attention to your child so that the child doesn't get bullied in school, do it. If it's that you should change your child from that school to another school where they appreciate your child's unique gifts and protect your child's mental state and don't allow your child to be fall into the circle of bullies, please do it. The society will be what the society is. Sometimes you cannot change society, but we hope that with education, with exposure, and with all this, we'll be able to bring the society in their aberrant behavior and their mentality to come and understand that these people are human beings too. They need to be protected, and everybody's effort from the home to the community at large can help to raise better children. So that's what you can do, really. What can one do to help with thyroid? Please go and see your doctor. Please go and see your doctor. Why is autism common in Western world compared to Africa? I do not have the answer to that. But remember, the genetic thing does not have any globe. It's worldwide. Can autism be diagnosed in someone in their 50s? Yes, if the person has missed diagnosis as a child. Thank you, the lady. Thank you, Moroccan Queen. If the person has missed diagnosis as a child, if the person has gone through some wrong or misdiagnosis as a child, the person may eventually get the right diagnosis in their 50s. So it could happen. Thank you for the follow, Sergio. Very true. They're beautiful. Okay. Unique. Okay. Africans will not accept the diagnosis. Well, that's why we're here. We keep on educating people. We keep on educating and trying to get people to understand the disorder and how to work. Dunia, I appreciate the struggle. I appreciate what you're doing. I appreciate what you are going through. I only pray that it's better. No, not this. I'm talking about most people. They're always staring. See, people will always stare. People will fear what they don't understand. People always stigmatize what they cannot appreciate. So keep on supporting your child. Try to educate the ones that are in charge of those people staring. Try to educate people around you. At the same time, you should not be trying to please everyone. Your child is your child. Your child is unique. Know that and let your child understand that by the attention you give to your child. Eventually, everyone else will come up. The autistic person that became a medical doctor, for instance, nobody will be staring at him anymore. The one that became a specialist. So